Let's talk about communicating in trends, or recognizing deterioration before a crisis develops. This video isn't about convincing providers to agree with you. It's learning how to communicate your concerns in a way that helps the entire team make better decisions. So I have a question for you. Have you ever taken care of a patient who didn't look terrible, but something didn't feel right? So picture it. You are taking care of a patient that's on norepi. Their blood pressure looks okay. Their oxygen requirements haven't changed, but they are slower to answer questions today, and maybe a little less engaged, and definitely more fatigued than yesterday. There's nothing about them that screams emergency, but something feels different. Your concern isn't based on one number, it's based on the whole picture. So, as nurses, we tend to often communicate in snapshots. Our patients do tell a story over time. So the question is, how do we communicate their story to the team? The answer is telling their story in trends. Nurses are taught to communicate the facts and to recognize patterns. Providers often make decisions based on the overall clinical picture, not just the single data point or the snapshot. The bridge is trends. Trends helps everyone to recognize deterioration before the crisis develops. So let's do a little exercise. Look at the table and ask yourself, what did the last 6 hours tell you about this patient? What patterns are you seeing? What trends are you noticing? Are you noticing that the patient's pressure requirement is going up to maintain MAP goals? Are you noticing that the heart rate is increasing and their urine output is decreasing? Along with the information earlier that we noticed that the patient wasn't as interactive, there's definitely a pattern that screams that this patient is getting worse. So I want to talk about a couple of ways that we might relay that information to the team. So I think the first thing that we as nurses tend to do is just, again, state the facts and absolutes. The patient's MAP 66 and the urine output was 15 mils for the last hour. And as I said, the providers tend to look at the overall clinical pattern, but we've just conveyed a data point. So they only have that one data point, and yeah, the MAP 66, that's not horrible, and it's easy to justify that the urine output is 15 mils because maybe they just haven't taken anything by mouth. So it's really easy for them not to be overly concerned. Versus talking to the provider and saying, over the last 6 hours, the MAP has decreased from the low 80s to the mid 60s. The pressure requirement has nearly tripled to maintain their MAP goal. And the urine output has steadily decreased, and they're less interactive than what they were this morning. And then I am concerned that their shock be worsening. Gives the provider a very clear clinical pattern that you've noticed that the patient is exhibiting while at the bedside. So say you relay all of the pertinent information about your patient and convey your concern, and the team decides that they don't want to add any additional interventions at this time. And you, as the bedside nurse, don't understand why. Two great questions that you can ask to help build understanding and collaboration would be, can you help me understand why the team doesn't feel any additional interventions are needed right now? And second, what changes or parameters would prompt intervention? This will help you as the bedside nurse to have a clear understanding of what the plan of care is and what the provider is looking for, what patterns and changes they are looking for that would prompt intervention. Lastly, as a reminder, every conversation doesn't have to end with a new order. Sometimes the most valuable outcome is understanding the plan. Sometimes asking those two questions can lead to a change in treatment. Sometimes they don't. Either way, you have gained a better understanding of what the team is thinking, you've clarified the plan, and you know exactly what changes should prompt another conversation. That's good communication, and that's good patient care.